Welcome back to NTV News First Edition. February is Psychology Month in Canada, and this year the association is warning of a crisis in Newfoundland and Labrador. Joining me now to talk about the survey and its results is the president of the Association of Psychologists in Newfoundland and Labrador, Dr. Janine Hubbard with Get Psyched. Great to see you again.
Well, thank you so much. Wearing a slightly different hat tonight, but I am hoping a really important one to be able to talk about.
Absolutely. So the association did a survey. Why did you feel a survey was important at this time?
We were really concerned because within the public sector, so health, education, post-secondary, we were seeing a massive exodus of psychologists over the last few years, even pre-pandemic, such that we have areas where vacancy rates are 30%, 50%, even higher, so that it's become increasingly challenging for the public to be able to see a psychologist. And we had also heard that a number of our members were leaving the public sector, not because they were necessarily looking for greener pastures, but because they were really unhappy with some of the conditions that they were working in.
So what did the results show, and were you surprised?
Yes and no. They actually showed very much what we had been hearing anecdotally. Psychologists adore the clinical work that they do. They love working with their clients. They love seeing them make change and progress and being able to help in that process. But what we saw was very consistent with what we've heard in a number of the health professions over this past year, is they were concerned about lack of autonomy, lack of respect, lack of ability to work to their full scope of practice, and in fact folks in management and folks making decisions really not understanding what a psychologist is or does, and treating them very interchangeably with professions that complement psychology but are not the same.
So after all of this, you've issued a call to action. So what can people do to increase access to psychologists?
We have, because we have to stop the hemorrhaging. The survey showed 65% of psychologists currently working in the public sector are considering leaving. That is why we're causing the alarm. We have both short-term and long-term goals. We need to talk about training programs and ways that we can increase the number of psychologists that we are training. However, before we can get to that stage, we have to stop the bleeding. What we need to do are address some of the systemic concerns that we're hearing from our senior psychologists, from our mid-career psychologists, because while there's been some great initiatives in terms of recruitment, we can't keep people if the work conditions are the same way they are at the moment, with the lack of respect, lack of understanding. And psychologists need to give an awful lot of supervision. We supervise graduate students, residents, and provisionally registered psychologists. So if you don't have those mid-career and senior career psychologists to provide the supervision and support to the new hires, you can't hire anybody because we can't provide that level of support. So we are asking the public, if you think it's important to access a psychologist, reach out to your MHA, reach out to the CEOs of the health authorities and the school board, reach out to the health accord folks and say, it's really important to me to have access to a psychologist in Newfoundland and Labrador.
Dr. Janine Hubbard,